antimicrobial resistant awareness walk. Okay.
Put it back to the normal. I put it on next bench.
That's okay. Where's Zara? So guys, we are just having a walk to spread the antimicrobial awareness. So if you don't complete your antibiotic, please next time when you get antibiotic, make sure that you complete the course. It's the only way we are going to prevent antimicrobial resistance. So at the moment, antimicrobial resistance is actually a threat, since we are getting antimicrobial resistance each and every day. Yeah, committed.
Yes, we push even though it's raining.
Yes. Guys, you know how we are fighting antimicrobial resistance in Namibia.
Hi, Hilaria.
Okay, can you please just say something about antibiotics?
Anything?
Anything that you wanna tell people about this awareness?
I think we are in a situation where we are moving drastically to antimicrobial resistance. Since I've been working in NIP for 5 years, the antimicrobial resistance has really increased in a very short time, which indicates now the seriousness of drug resistance, and I think we should really do something about it.
I agree with you. We really need to do this awareness. Yeah! So guys, we are just having a walk to spread the antimicrobial awareness. So if you don't complete your antibiotic, please next time when you get antibiotic, make sure that you complete the course. It's the only way we are going to prevent antimicrobial resistance. So at the moment, antimicrobial resistance is actually a threat, since we are getting antimicrobial resistance each and every day. So we are at this beautiful park. We're just going to have a presentation on antimicrobial resistance before we leave. So we really hope that we impact 1 or 2 people on antimicrobial resistance. Or do you want to say something?
Here also.
Okay.
Here, see, week. 18 to 24 November.
Yeah.
Yes, we are doing it.
So we are creating awareness in Namibia. We must now also do the same what they are doing. Okay.
Posed by inappropriate use of antimicrobials in human, animals, and crops. The intent is also to encourage responsible use of antimicrobials. This year's theme, which is similar to the one of last year, is to prevent antimicrobial resistance together. And the theme is calling for urgent joint action by our leaders and us as communities across various sectors in the context of One Health approach. Infections that were caused were over 1.2 million deaths globally, 1.2 million deaths that are attributed to antimicrobial resistance infections. This figure is more than the deaths that were attributed to HIV and malaria combined. Sub-Saharan African countries bears the highest burden of AMR associated death. We are at the rate of 99 deaths per 100,000 people. And this is exceeding the previous global projections of 700,000 annual deaths from AMR. We need to take urgent action and address the main causes of AMR. And these causes includes the misuse and overuse of antimicrobial medicines, lack of access to clean water, sanitation and hygiene, poor infection prevention control practices, inadequate use of vaccination to decrease infections. As the contributing factors continue, inadequate laboratory capacity, including equipment and reagents to guide proper diagnosis and treatment, poor waste disposal practices in the healthcare facilities, and as well as the presence of antimicrobials in crop productions. So what have we done as WHO to address this? Together with the partners, WHO spearheaded several initiatives aimed at addressing AMR. In 2015, the World Health Assembly adopted the Global Action Plan for AMR, and this action plan aims to ensure that for as long as possible, continuity of successful treatments and prevention of infectious disease with effective and safe medication use are quality assured, used in a responsible way, and accessible to all that needs them. And from that, all the member states have committed to develop, implement, and monitor multi-sectoral AMR action plans, which is also referred to as SNAPs. So WHO collects data on an annual basis to track the AMR assessment through a self-assessment survey, which monitors the implementation of countries on NAPs. And the results were as follows for this year. 93% of the countries have established NAPs plan on AMR. And 68% of the countries have got some elements that they are implementing from the NAPs. Only 27% of countries have costed and budgeted their NAPs, and they are monitoring the implementation thereof. And lastly, only 11% of countries have made provision for financial support for the implementation at national level. So this indicates that there is an urgent need to strengthen AMR governance and leaderships in countries, and for additional financial and technical support to be provided to countries. In addition to that, WHO has also developed a publication called AWARE Antibiotic Book. AWARE stands for Access, Watch, and Reserved. This publication contains evidence-based guidance on the optimal treatment for over 30 common infections, including when antibiotics are not needed. So colleagues, I urge you to get this book. If you do not have access to it, at the Namibia country level office, we are able to avail this book, which can guide us as healthcare provider in the provision and the issuing and the dispensing of antibiotics. Ladies and gentlemen, as I near my end, as we mark the World's Antimicrobial Week this year, WHO joins hands with the Ministry of Health and Social Services, as well as other stakeholders, in their appeal for increased high-level political advocacy to highlight the depth of AMR threat. We all have a role in containing this global threat on a personal level as well as on a professional level. We need to improve as individuals our health-seeking behaviors, and also seeking professional help when you are sick, and we must avoid treating ourselves. And also ensuring that those that are close to us adhere to taking of antimicrobials as prescribed. I would also like to take this opportunity on behalf of Dr. Branto to ensure you the commitment of WHO in supporting the Ministry of Health and Services in combating AMR through the One Health approach. I wish you a fruitful commemoration of the World Antimicrobial Awareness Week. Thank you very much.
All right, thank you so much, Ms. Erastus. I think we always lean on the World Health Organization for guidance, technical assistance, as well as support when we're engaging in most of our health-related ventures. So thank you so much for always being committed to assisting us in those ventures. Without further ado, I'd like to welcome our Deputy Executive Director, Ms. Petronella Masabane, to give us the keynote address.
Thank you very much, Ms. Nishekwa, our Director of Pharmaceutical Services and moderator of this session today. I will stand by the protocol that was established by the Director of Ceremonies and previous speaker, because we are already beyond schedule. First of all, I want to apologize for being slightly late. You know, if we work in the townships, and there we don't have a problem there at the hospital with parking. So I haven't been to downtown for a very long time. I forgot that it is not easy to get parking here, so my apologies for that. I know that maybe you actually enjoy not being in the office today, that you are outside, because it is such a beautiful day. So I don't think it was much inconvenience. Was it a hot day? I'm sure you'll be very angry with me. Okay, so thank you very much for having me at this very important event, and apologies from our seniors, including the Minister, the Deputy Minister, and the ED, for not being able to share this important event with you and to support you throughout the march. We have been summoned by the Prime Minister, and the reason why I only joined you now is also we had to prepare for the briefing with the Prime Minister, which the Minister and the ED will attend very soon. So once again, I indulge your understanding. I want to extend my sincere appreciation to the organizers for orchestrating this pivotal event, and to each of you for dedicating your time and your energy to a cause that holds the key to our collective well-being. I cannot overstate the gravity of the challenges we face in antimicrobial resistance. It is a multifaceted threat that extends far beyond the confines of healthcare institutions. It is touching the very fabric of our societies. The time for complacency has long gone, and today, as you have marched, you have become active agents of change, advocating for a world where antimicrobials remain effective tools in safeguarding our health. AMR is a phenomenon that occurs naturally. However, it is accelerated by the overuse or misuse of antimicrobials. AMR negatively impacts health outcomes and healthcare costs, driven by the fact that patients with resistant strains are likely to be hospitalized for longer, and that medicines used to treat the resistant strains are very much expensive. And that those medicines also have more difficult adverse effects than those used to treat susceptible strains. There is also the risk of reversing the gains made possible by the effective treatment of curable infections such as tuberculosis and malaria. If left unchecked, we risk regressing to an era where once treatable infections become fatal. People will die of it. And the advancements of modern medicine unravel before our eyes. The larger the volume of antimicrobials used, the higher the risk of developing AMR. According to data routinely collected by the Ministry of Health and Social Services through our pharmaceutical information systems and the indicators that we collect from our health facilities, about 47% of outpatients in the health facilities in Namibia receive at least one antibiotic during the financial year 2022-2023. This is much higher than the WHO recommended threshold of 35%. Evidence of resistance to antimicrobials from the Namibian Institute of Pathology, commonly known by all of us as NIP, also indicates that there is an increase in antimicrobial resistance in humans in Namibia. This is compounded by increased use of antibiotics in aqua, that is water, and agricultural sectors. This is due to increased demand for animal production, which leads producers to use antibiotics for growth enhancement to meet these demands. Our march today is not only a symbolic gesture, it's a call to action. A call to bridge the gap between awareness and tangible change. It is a manifestation of our collective commitment to advocate for evidence-based policies, heightened surveillance, and investments in research and